In a recent episode of HBO Max's ER-type television show, The Pitt, a white, middle-aged, seemingly well-educated, and seemingly wealthy guy walked into the ER complaining of muscle cramps, nausea, and diarrhea. He denied all drug use, but then he kind of slipped it in there that his back was killing him, and that in the past he'd been given morphine and it seemed to work for him. Now, the younger of the two doctors in the ER wanted to give him the morphine, but the older of the two doctors said, "Hey, let's go outside and talk about this." And she said, "Listen, this guy is exhibiting every single sign of opiate withdrawal." So they went back in his room and they gave him something without telling him that it was a medicine for opiate withdrawal. They said, "We're going to give you something that's going to make you feel better." And the patient, thinking that he would eventually get the morphine, went, "Okay," and he took it. A few minutes later, the patient said, "I almost feel well." And the doctors gathered around his hospital bed and said, "Look, the medication that we gave you is a treatment for opiate addiction, and it wouldn't have made you feel better unless you were in opiate withdrawal." The patient, feeling stigmatized, started screaming, "I'm going to sue this hospital. How dare you do this to me?" But when they talked to him and said, "Look, addiction is not a moral issue. It can affect anyone," and then offered him a prescription for the medication, he calmed down. What I like about this TV show, The Pitt, is that they showed doctors using Suboxone to smoke out someone who's addicted to opiates, but in denial. Welcome to The Radioactive Patient, a music, art, and mental health mashup. I'm Allison Strong, your host. Here are some statistics as sourced from a New York Times article that I'm linking to in the About section below. The article discusses a 2015 study where opiate-dependent patients were divided into three groups. The first group was given a referral to an outside drug treatment facility. The second group got counseling, one session, and was referred out to the same drug treatment facility. And the third group got counseling, was referred to the drug treatment facility, and then got a prescription for buprenorphine naloxone, brand name Suboxone. The doctors followed up a month later, and lo and behold, the Suboxone group was twice as likely to still be in treatment. The unusual aspect of this study was its setting, the emergency room. Emergency rooms typically address acute medical emergencies, not long-term issues like homelessness or drug addiction, which require a long-term approach. Also in emergency rooms, there's a lot of not my jobism and apathy when it comes to people addicted to drugs. More evidence in favor of Suboxone. Back in the 1990s, France was experiencing their own opiate epidemic. And what they did is they lifted all restrictions on the prescription of buprenorphine, allowing any type of doctor to prescribe it. And by the early 2000s, the overdose rate had dropped by 80%. With these kinds of statistics, it's hard to understand why in this country only 10 to 27% of people who could benefit from Suboxone actually are receiving it. And only 30% of drug treatment centers in this country offer it. In fact, you're more likely to be offered Suboxone in the emergency room thanks to the efforts of a few renegade doctors and some forward-thinking public health officials. I will be doing an episode on the specifics of these heroic efforts in the next video on this topic. I'm Allison Strong. Thanks for joining me for part one of this two-part series on Suboxone in the emergency room. If you like this video, please like it. I'd really appreciate it if you made a comment. All these kinds of things tell the algorithm to push this video out to more people, and that way more people can be helped. I'll see you on the next video, and until then, ciao for now.